Hello all, my name's Tim Cooper and today marks 3 weeks since I had off-pump triple bypass surgery. Off-pump triple bypass means that they didn't stop my heart. They used like clamps and a few things and kept the heart beating to do bypass surgery on me. It's a relatively new technique. Although I didn't have the complete non-invasive option where they go through the ribs a little bit, mine had the sternotomy, which is traditional even with the on-pump where they stop your heart and that. The traditional sternotomy down the breastbone. But it was overall less invasive because by keeping the heart beating and not relying on a machine, it's sort of, they don't have to stop your heart, and I think recovery's a little bit quicker. So I've done really, really well. I'm well and truly home in the country now. I had it done in the city of Perth. I live in Western Australia. I've been home about 7 days from Perth now. I won't be going back to work for another 3 to 4 weeks. Well, they recommend 2 months at the earliest. So I've got time off work and I'm, doing very, very well. I stayed with my family, some of my siblings, like sister in Perth for about 7 days. I was in hospital about 6 days after the op, and when I was well enough to go home, I stayed in the city for a while because I'm closer in case anything goes wrong there than in the country, because I only live in a very small country town and there's not many emergency services and that here, but I'm doing really well now. I had an appointment just before I come back down to the country and they gave me the all clear to go home and continue with my meds. It wasn't exactly 100% a smooth surgery though. I did get what's called pericarditis. Pericarditis is where the heart sac or the pericardium, it's like a fibrous sac around the heart. Mine actually swelled up. The doctors have to remove that to graft the veins right in the heart. But what they do is they sew it back up. They don't fully take it off the heart, so they sew it back up. But the thing is, mine swelled, and the condition's called pericarditis. It actually is rather rare with open heart surgery, but darn it, with me, it happened to me. And so there's a bit of swelling there. I was getting an irregular ECG for a while, which means that, the machines were making weird noises and my sine waves on the heart were a little bit irregular for a while and pulse started going a bit quick. But after a while, it all settled down and they got me on medications to slowly, like anti-inflammatory medications to take the swelling of the pericardium down. So I've gone home and I'm still on them to this day, and I think they've really helped me take the swelling down around the heart. So I notice when I'm, just at home now and I test my pulse or feel my pulse, I can tell it's regular and I can tell it's really, really improved, and I think my heart's back to normal, and hopefully I haven't got any permanent rhythm damage or anything like that from the pericarditis. I don't think I have. I feel really good. I see the doctor again in a few more weeks for a review, so he's obviously going to do a lot of ECGs and things like that. But other than that, I'm feeling really, really well, and I'm really, really glad to be home. It's a nice sunny day today. I sort of only just last night started sleeping on my side because they recommend for the first few weeks or so after the op, you've just got to sleep on your back because the sternum has about 4 wires that hold it into place, and it can get very, very irritated if you sort of lay on your side. It can be very sore. Last night I tried laying on my side and I was all right. I was pretty good. A little bit of tenderness, but not enough to cause anything. So I obeyed all the principles there and waited 3 weeks, and I managed to get some sound sleep last night on my side, which was really good, and there wasn't a lot of pain there. So far so good. I'll be able to drive again in about another 2 to 3 weeks, because I'm 3 weeks in. They reckon 6 weeks, 5 to 6 weeks before you can drive. So also during the operation, part of my lung collapsed, but that's not uncommon. It was only a very small collapse towards the back of the lung with me though, and it was not enough to cause a catastrophe during the operation or anything like that. And in fact, a lot of the fluid, there was a little bit of fluid from it, but it all drained off, because in your chest they put like 2 little drainage pipes to drain any fluid from, possible lung collapses or anything that can happen. They prepare you for all that. But the doctors said to me it wasn't a major enough collapse to cause any, major health concerns or anything like that. And they said the collapse of my lung will straighten itself out. And I really feel it has straightened itself sort of back out now. I'm walking about 2 kilometres a day, but just gently. I don't push myself or anything like that. So I'm doing really well there, and I know my heart's in a pretty good rhythm now. I remember just after the operation, I was getting terrible pain right in the middle of the chest. It was like, almost like angina. It was like heart attack pain, but pericarditis, because that's part of the heart and it's part of the sac of the heart, it's like angina because it is direct heart pain, and mine was swollen. It was really crushing and horrible. Like something was burning, just where my finger is burning right in the center of the chest, but that's all gone now, and I'm breathing really strong. So I just took a big breath then. I'm breathing really strong, not getting any pain there. So they use the radial artery in my arm for my bypasses, so I'll just hold that up to the camera. Where are we? Here we go. You can just see it there. Right down there. That's where they took it from below the thumb, and they went right along to just near the elbow, at the top of the elbow. So that was actually used to bypass a lot of the bypasses, but they also used the internal mammary arteries, left and the right. The internal mammary arteries are ones that run along the chest wall, so they just stitch them across to the heart. And apparently they're one of the best arteries to graft because they don't block and all of that. So I had a very successful operation there because I used the mammary arteries, and they reckon the radial artery, which I just showed in my arm, is better than using the saphenous vein in the leg. It tends to be more like the internal mammary arteries. It seems to be a better artery for longevity. So the surgeon doing off pump and using those arteries done the very, very best with me. So the only little setback was the pericarditis, which was causing an irregular ECG, but I think that's not permanent rhythm problems or anything like that. And I think it was just because the heart just chucked a bit of a sab, because the heart doesn't like, being tampered around and surgery very much. Well, no one's heart does, but yeah, no, the pericarditis usually only lasts, the doctor said, about 3 weeks max, and then it sort of goes. But I think mine's more or less gone now. Well, it's been about 3 weeks anyway, and I'm on medication called colchicine or something. I don't know if I've got the name right, but it's something colchicine or something. It's an inflammatory for gout. It's an anti-inflammatory for gout in the body, and it also is very, very good at treating pericarditis or swelling of the heart sac. So yeah, no, I feel a lot better. Also a little bit of metoprolol. Metoprolol's a good medication for blood pressure. It's called a beta blocker, so it's good for blood pressure, and it helps the heart really stay in a good rhythm. And also after surgery, it's very good at healing the heart. But I'm only taking like half a tablet a day. So I'm taking a quarter of a tablet in the morning, quarter at night. So that's equal to about half. So I'm not taking a big dose of that. But I've never had very many rhythm disturbances. My heart seems to be going really, really well now and getting better blood flow. So feeling good. So this is my review 3 weeks after triple cardiac bypass surgery, which was off pump, which is a relatively new procedure where they don't have to actually shut your heart down or stop your heart. You just breathe with a tube. I was under anaesthetic, of course, and they put a tube down my throat to deliver oxygen to me and breathe for me. But I didn't know anything about it. I was under anaesthetic, but they kept my heart beating. So it is a little bit less invasive, but unfortunately I developed pericarditis from it, but it's not a really big issue because pericarditis is generally a temporary condition unless it gets very serious. But mine appears to only be temporary from, just cutting the pericardium. Maybe it chucked a little bit of a sab with that, but I feel really good now, and I'm on the right medications to reduce the inflammation there. And I'm not getting irregular palpitations or anything anymore, or bad irregular heartbeats. My heartbeats and pulse sound really smooth. They feel really smooth in my neck. In fact, my heart's beating really, really good, actually. I don't know how long I'll stay on the metoprolol or the colchicine. The colchicine probably for a few more weeks, but then the inflammation will be well and truly gone. But I don't know whether they're going to keep me on heart medications in case of rhythm disturbances for life, or whether they're going to take me off of them. Maybe my heart doesn't need them after a while, so even better. But yeah, the surgery's out the way. The reason why I needed the heart surgery just before I go is because on my father's side of the family, there's a strong LDL cholesterol, high LDL cholesterol genetic. I done the genetic test, and mine was very, very high in the LDL, which is retention of LDL cholesterol. And for years and years, I sort of looked after myself, was pretty healthy and everything, but I don't drink or smoke much, but mine just gradually built up over the years, unfortunately, to 3 major stenoses on the heart where I needed an operation. I'm glad I've got the surgery out the way though now, and I'm very, very glad that they've grafted the veins and they've repaired them. Well, it's not a cure for heart disease, but it makes my chances of heart attack so much more smaller, and I just got to go for regular checkups to make sure that nothing else is building up and stick to a real sound diet. And I'm on a medication which is delivered into my tummy every 2 weeks. It's like a pen, a click pen, but it's called Repatha. And Repatha actually tells the liver not to produce the genetic bad LDL cholesterol. It helps the liver not release any bad LDL cholesterol into the blood. So if I stick to that, that'll really, really help me no matter what I eat with my diet, but I'll try and eat really healthy. It'll keep the bad cholesterol down that caused the blockages in the first place. But apart from that, I'm doing really well. I'll just quickly, before I go, I'll show you my chest. As you can see, that's where they open my heart up, right at the top of the throat going down. And they're the 2 drainage pipes. The 2 drainage pipes are in there, but that's all healing very well. And yeah, the radial artery in the arm. Yep, that's where they took that. They didn't take any from my legs, so no, I'm doing really well, and my heart's in rhythm. I can walk all right, my heart's staying good, and I'm getting fitter by the day. So a success story. Off-pump bypasses out the way. I'm 51 years old. I didn't want to wait till I was 60 or 70 to have the op or something go wrong, so I've had it at the right age, and this is my progress 3 weeks later. Thank you very much, everyone, for watching today, and good luck if you've got to have bypasses. And I certainly hope you can have an off-pump procedure, because I think that's a lot less invasive. If I had have had the on-pump, I probably would be still a little bit unwell today, but maybe I'd be all right, I don't know. But I just think that the off-pump procedure is a little bit less invasive than on-pump. But don't panic if you've ever got to have bypasses. I've soldiered through it, I've got through it. I was relatively fit before the operation though, but the operation has a 98% success risk, so, you know, I had really, really good surgeons, and the surgeons today are amazing what they can do. You may be down for about, 2 months or 3 months, but it's for the better, it's for your future and less risk of heart attack, and I'm doing well. Thank you, everyone. Bye for now.